Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. It is 23 after 9 o'clock. A slight delay in the programming this morning. Sadly, we've been having a bit of technical issues, but we're up and running, and we do hope that you are tuned in. Um, our next guest is on standby. He is Mohamed Hoosen Suleman, currently a fifth-year medical student at the Nelson Mandela School of Medicine at UKZN. He's a recipient of multiple awards and accolades during his medical career and is recognized as one of UKZN's top medical students. He recently returned from Denmark, where he was invited by the European Society of Clinical Microbiology and Infectious Diseases to take part in the conference and speak about some of South Africa's health policies. He was also part of the high-level meeting on antimicrobial resistance in Denmark, hosted by the World Health Organization and the Global Health Leaders Group. We invite him today to share his reaction to WHO's calling an official end to the public health emergency of COVID-19. Assalamu alaikum to you, Mohamed Hoosen Suleman. Lovely to be talking with you once again.
Walaikum salam. Thank you so much for the invitation. It is certainly my pleasure to be here, this morning.
Alhamdulillah, let's kick off right away by asking you the all-important questions. The first one being, what does it mean that the WHO is called to end the COVID-19 pandemic and is now no longer considered a public health emergency?
It simply means that in official terms, the pandemic is over. And so this means that we're not living under a state of health emergency as we have been for the last 3 years. But I think it's important to remember that COVID-19 is still present, and in some parts of the world, there is still transmission of the virus. But of course, the transmission is at a relatively low level. Now, the COVID-19 Emergency Committee of the World Health Organization, they met on Thursday last week. And I think this was the 15th meeting that they've had since the start of the pandemic. And the point of these meetings is to discuss the state of transmission of COVID-19 in the global setting and to assess the response of different countries, of the member states of the World Health Organization in the fight against the pandemic. And in the committee, it was unanimously agreed that the public health emergency of international concern of COVID-19 should be called off. It was declared by the Director General on the 30th of January 2020. And that recommendation was actually submitted to Dr. Tedros, who is the Director General, and he had accepted it, and we find ourselves in the situation today.
Okay, so in a practical sense, does it affect our lives as ordinary citizens that WHO has called for the official end of the pandemic?
No, it does not, because we have been living life freely as if there's no viral transmission for the past year. And you'll remember in June of last year, our Minister of Health, Dr. Joe Pashla, he repealed all regulations of COVID-19. And this has allowed us to move freely. And I think even in many parts of the world, people have been moving freely and there have been no restrictions. But that is ultimately what led the WHO to make an informed decision, a decision that is guided by science and evidence-based medicine. And that's based or the information or the data that has been collected. This is as a result of the continuous low levels of transmission for the last year. And I think we are at a point of the lowest levels of both transmission and morbidity in relation to COVID-19. And in fact, in many parts of the world, they are not even reporting statistics when it comes to COVID-19 because there's simply no need for those statistics to be recorded. It's simply at a low level. And yeah.
Okay, so technically, what you're saying to me is that COVID-19 has disappeared, as you've also indicated, not completely, but I guess what I'm asking is, does this say that we should simply forget about it, that very dark period in our history? Um, or should there still be awareness amongst us regarding the virus still being present? And if so, then what sort of precautions ought we be taking, knowing that the levels have dropped almost to nil?
Yes, absolutely. I think there should always be awareness that the virus has not completely disappeared into thin air. It's an airborne virus, and the unpredictable nature of how the virus behaves, we have seen it in the early days of the pandemic. And all it takes is for a mutation to develop, to actually dominate. And it's once the favorable version of the viral strain, if that takes precedence, then we'll find that transmission of the virus will increase. So, in as much as we continue to live freely and we move about openly, we need to be equally cognizant of the fact that there is still a microorganism of SARS-CoV-2, and that it is still with us and will most likely forever be with us. And it's just that it does not pose a threat as it used to previously. So I think we must always be cognizant that it is still with us, right? But it does not pose a threat as it had been for the last 3 years. So I think we should always be aware. We should be cautious in our everyday life.
Okay, what are some of the lessons and positive aspects that we can take? I'm not sure if we can say positive aspects that we can take from the COVID-19 pandemic. Everything I kind of reflect on has been terribly negative, but be that as it may. And when you talk about being cautious, even though it's dropped to very low levels, what type of precautions ought we be taking? I mean, I still, when I'm in a mall or in a shopping center or in a crowded place and I hear someone coughing, I become almost paranoid. I don't want them anywhere near me. I don't want, them to be passing their germs or whatever it is onto this large crowd.
That's a good question. And I think there are multiple lessons that we can take. And perhaps I will make mention of three key lessons, right? The first one being is that we must appreciate and take care of ourselves, of our body. This life and this body that we have, I often say it's a blessing from the Almighty. It's an amana, it's a blessing. And when we take care of this body, we do not fall prey, we do not fall vulnerable to diseases and the ailments that we have out there. The second, I think, is to maintain good hygiene practices at all times. So this is, it's the simplest and it's probably the single most effective tool that we have to ensure diseases do not spread in the open. And as we go out, we need to ensure that we sanitize, that we wash our hands, ensure good ventilation in closed spaces, and to wear a mask if you think that you are going to a place that is crowded and that may potentially pose a high risk of transmission. We already know these steps. We have been doing it for the last 3 years. And I think we should continue, we should conscientize our people to be cognizant of it. I think the third one is that we should not fall prey to false news and fake news. This is a major concern, and it has been even for the World Health Organization at the highest level and for other international health agencies, that the misinformation, the disinformation, right? Um, this pandemic of infodemiology, right? It can spread rapidly. Dr. Tedros had also made mention in his address on Friday last week that we need to remind ourselves to take information from authentic sources, right? So I think, in essence, these are the three key points that I would make mention of insofar as the positive lessons or the key takeaways that we can take from the pandemic. It has been a tough time. It has been disastrous on the world. But if there's anything positive that we can take, I think certainly it would be these three key messages.
Mohamed Hoosen Suleman, unfortunately, that's all we have time for. A very important question that I did want to put to you is the different discussions you had in Denmark. But let's leave that for another time. Perhaps later this week or next week, we can revisit this issue. I think it's important enough for us to revisit it. So thank you indeed for your time. And I look forward to talking again, inshallah.
Jazakallah so much.
It is exactly 9:34. News and views on Salam Media. Standing by to talk to us is Executive Director of Agri SA, and he's also an agriculturist, Christo van der Reede. We're going to be talking about food security or food insecurity right here in South Africa. Please do stay with us.